Hi, this is Dr. Kogan. I want to give a brief introduction to Healing Energy, Healing Presence talk by Luan Jacobs, former Reiki master at, well, actually not former, a Reiki master at GW Center for Integrative Medicine. She now works at the center remotely. And Elizabeth Goldberg, licensed massage therapist, health coach, and former program director at AIM Health Institute. And Luan and Elizabeth have a very profound, deep understanding not only of the energy principles and working with patients, but just a sense of how do you create the healing presence for each patient during encounters. So they're going to go into a very deep dive on that. They're going to review kind of an overall amount of understanding and evidence in this particular topic, and also some definitions and practical applications, and how so you fully understand when you seeing your patients and either questions about energy medicine come up, or you simply want to have a better sense how to communicate with patients using some of the principles. So yeah, and from my perspective, I want to add to their talk is some of my experiences working with patients, while I'm not claiming that I have any expertise in energy healing, so to speak, but I have learned Reiki in medical school actually, and also this rather unusual approach called biodynamic craniosacral therapy, which is an osteopathic method, but it's more energetic than manual. There's not a lot of physical manipulation. And my interest in this and experiences have led me to believe that this is highly underutilized and under-recognized approaches, and not necessarily that there's very clear double-blind randomized controlled trial evidence for any particular condition, but just due to the fact that we know that these modalities tend to have a very profound centering effect on the central nervous system, and they are not only allowing to dramatically enhance, potentiate placebo effect, but they can allow patients to find this kind of a peace-centeredness and calmness in the storm of their living, especially for those who are suffering with profound despair for whatever the reason, whether it's a medical induced problems that are overwhelming them or purely psychological underpinnings. It doesn't really matter. These practices give non-medical way for patients to deal with issues of unbalanced nervous system. And in more scientific language, I would say that whenever the nervous system gets decentered or just unstable, and we're not able to regulate ourselves, the life becomes even crazier in a way that you're no longer capable of controlling your emotions, controlling your impulses, and subsequently people often make not just bad decisions about everything, but more importantly, they really they push the inflammation up. They not allowing their system to get enough rest and enough recovery at night. Basically, you're having this, you can think of this as a hyperactive train or train that speeds up and you can't slow it down, and eventually it starts causing a variety of physical illness, and we already talked about this, and other experts talk about this. So without further ado, I know it was a little bit of a longer introduction, but I wanted you to have my take on this, and the fact that I think that whatever you end up practicing, short of pathology and radiology, you will be interacting with people, and you have to be able to center yourself. You have to be able to center the patients through centering yourself. So enjoy this presentation, and the quiz on this topic is going to be relatively easy, just because it's the point of this quiz is really to teach you even more, not necessarily to test the knowledge, since this is not necessarily highly evidence-based topic. We recognize this, but we still feel it's really valuable for you to spend time thinking about it and listening to experts. Thank you.